Welcome to Bite Size Dental Marketing. Today I have Ian. Ian, thank you so much for getting on the show. We're getting back to recording more regular now that we're through the holidays and the company trip and stuff. What do you want to talk about today?
Today I want to talk about something that most of us are not really good at, and something that we need to
Present
always
company
work
included.
on. Present company included. And that's communication. It can make or break your business, your marketing efforts, your practice. And today I want to unpack a bit with you, Eric, why it's so important, how it's going to help a dental practice and overall marketing efforts, and just how dentists can work on being better communicators when it comes to the topics that matter in their business.
It's a tough one. I would say after just good old-fashioned empathy, it's probably the most challenging leadership/management effort there is. And I read some saying or, heard it one time that it doesn't matter how smart you are or how good your idea is or how good you are, you're only as good as the level you communicate to. And that's humbling to think about. But I'm with you. I wish there was more consistent communication sometimes from offices, especially when they start to underperform or when the dentist is feeling like they're underperforming.
Mm.
I feel the panic communication sometimes. I feel inconsistencies, and we get into using, like Mark Twain said, I didn't have time to write you a short letter, so I wrote you a long one. I think all those things play into poor communication that we would like as business leaders, but I think it ties into marketing specifically, lack of consistency and that lack of this is who I am and this is what type of patient I want and this is what my brand is. I think that leads to the marketing team changing tactic, which can hurt, which, is not free.
And it's fine to
do.
change your mind.
Mm-hmm.
It's okay.
Mm-hmm.
People change their minds all the time. It's up to you to then communicate that. And that's where communication ties back into all of this. Eric, I always love to tell the story of the example of your wife or husband's on the way home. You're sitting at home. You just did the dishes, babe. You're feeling good. You're ready to receive. Thank you so much. Thank you that. Yeah, man. You even fluffed the pillows. You vacuumed a little bit. You've done your part. Or on the lady's side, you cooked an amazing meal. You're ready. Your partner comes home distraught. Why this? Why this? Because in the car ride home, they're working themselves up about something that you have absolutely no idea about. And then you arrive and then you expect this person to understand why you're so upset. And they're just completely confused about what's going on. And you can apply that to most business engagements that we are involved in, or conflicts, or ideas, or visions
expectations. Yeah.
You can't expect your team, whether that be your patient coordinators, whether it be your hygienist, whether it be your accountant, whether it be your marketing team, to just know what's going on in your head. And that's the mistake I feel we as human beings often make. We assume someone understands instead of confirming, instead of making sure, instead of really trying to articulate yourself.
Yeah. I think my version of that I do poorly is it's always over generally a difficult topic. Someone's underperforming, or I perceive someone to be underperforming, or there was some expectation not met of mine, whether justly or unjustly is irrelevant. But I tend to want to have a good conversation. Like I don't want to go in just sort of hey, I felt this way. So I tend to play over the conversation in my head. But in doing so, I tend to script out what I'm going to say. And then I get in the conversation and I just let it go. Wham. And the problem is I don't go in with enough understanding, and I'm using 38 words when 5 will do. And because I'm uneasy, I may be bouncing around topics in the same conversation. And that is such a challenging thing for me to just say, hey, I'm a little bit frustrated at the way you handled that. I would like it moving forward. And I don't know, I feel this need to build a case. I feel this need to have this long conversation. And it really has not done me well from a leadership standpoint, because the longer the conversation is, the more topics we cover, the more that I'm talking at someone, the less they're actually taking away. And I still, even to this day, I don't do it amazing. I find myself in a lot of conversations to where I'm like, oh my God, I can see them not paying attention. I can feel them not paying attention. And it's because I'm literally just talking at them.
Mhm.
And I think that's one of those things that I wish I could do better.
But again, Eric, I think you're in the majority there. This is not
Oh,
something that you
sure.
should say. I'm guilty of this. I think this is what most people are guilty of. And
Uh-huh.
what ties
Uh-huh.
into that for me is a podcast I listened to recently said, to be the best communicator, you need to learn to listen. And at first, when you hear that, you go, okay, but how does that work? And that plays into exactly what you were saying now about going into a conversation with preset ideas or what you're going to want to say. I have the fault of, I'm so excited about what I want to say that at times I don't fully listen to what the person says to me to
Uh-huh.
begin with. So you're so ready to say again what you want to say, and that's poor communication. That's not listening
Yeah.
to the people around you. And again, to bring it back to marketing or your practice, if you live in your own reality of what's going on and you're not listening to the people around you and communicating clearly, very quickly those bricks will start to fall around you, whether that be in marketing efforts, whether it be internally, whether it be with patients, because you're not spending the time to listen and communicate better through that way too.
You just triggered a funny thought of mine of, not listening and the humility, right? Our pastor challenged us to keep a journal of, how often do you have the 7 deadly sins, right? And, you're just supposed to journal, I was prideful, or I was, slothful or whatever, and how you felt in the moment. And I don't want to get into that, but it's funny. Do you know, it won't surprise you, but my most journaled sin is pride. And do you know how it comes around most in conversation is I think that my opinion, because, I'm the boss or I own the company or whatever it is more important. And I'm so prideful that I'm giving my opinion before I even seek to understand the other person's. And
Mhm.
I'm telling you, if you look at my little journal, there's, like 1 or 2 here and 3 or 4 here, and then there's pride, and it's like, it's like the journal entries. But it's funny, but that's one of them that I find that pride gets in the way of good communication and having the humility to understand their point of view, even when I don't agree with it. And I think that's where I get caught up in pride. Like I know they're wrong, but I still should. Wait, that's prideful. That's awfully dangerous right there too. I think they're wrong, or I'm assuming they're wrong, but I should seek to understand at least the point of view so I can have a more clear outcome. But instead, I tend to push my agenda, and we don't come out better because they're not listening to me either.
And
And
exactly, and that's where things then start to get lost.
uh-huh.
Of you have
Mm-hmm.
this, nobody's actually at fault. Both people are just either excited about what they want to say, or some of the flaws are playing into the conversation. And both people, for me, always, or the group, I truly believe that the majority of people want what is best, whether that be for the business, whether it be for marketing, whether it be for anything that you're doing. I genuinely believe most people want to do good. And even if there's a mishap or problem occurs or something that we are upset about, then I never go straight to it was the intention for them to botch this or to not do what I asked
Sure,
them. And
sure.
that's again where communication between you and your team members and between you and your third party vendors that you're working with. Don't get, Eric, you mentioned earlier a phrase that I like, the panic
Mm-hmm.
communication, the panic texting. If you're getting to that point, dentists, you've left it for too long.
Yeah,
Don't wait
yeah.
until you get to panic or until there's frustration or until there is anger even in your heart on what is going on before you're opening up communication lines, because we tend to bottle things up,
Mm-hmm.
try to avoid conflict, and that's a poor communication style. You should
It
not
is.
bottle things up, because what's going to happen? It's going to come and bite you.
Mm-hmm.
It's going to
Mm-hmm.
get you at the end of the day. So that's another thing I would advise, that whatever is going on, number one, as we mentioned now, listen to the people around you so that you can truly assess the problem before you have your own opinion. And then the second one is, don't expect people to just know what you're thinking and what you're feeling and let things build up, because in your own world you're addressing it, but nobody else around you knows. Speak to your people. The whole band-aid method of Count to 3, rip it off. If it's something uncomfortable, do it, because you will always be better off at the end of the day.
Now, what do you think is the most common miscommunication between a dentist and a marketing team?
That's a good question.
I have mine while you think about yours. Are you ready?
Yes, I'm ready. I'm actually ready.
Hit me.
How I want to be represented online and what I actually see when I then finally take that step of Googling myself and going through every single page on my website. Because dentists don't regularly do that. But then when they finally do it, they realize, well, this isn't how I thought. But then you had never communicated from the start that I want this page to look like this. I want that to do this. I want this service to represent it. And of course, if you did that and your marketing company did not do that, that's a whole nother discussion to have, because then, again, it's just actions that were not pulled through. But to sit at 11 o'clock after a glass of wine, going through your website and saying, what are these guys doing for me? I've definitely gotten that a few times but Doc, you never said to us that this was an important service. You never said to us that you don't like this picture on the website, especially when it's a previous agency that built the website and it's some third layer page that we didn't even know existed. So that, for me, I would say, is a common thing of regularly monitor yourself online and make sure that your vision is in alignment with what you have presented to your marketing agency.
That's a good answer. That might be better than mine. Might be more often. I think mine is for impact, maybe that, or my emotional impact of when it happens. Mine is, you know what, my schedule's full. I don't want just any new patient. I want implant patients, or I want Invisalign patient, or I just want cosmetic patients. And then the marketing shifts to those. And over time, their new patients dwindle, or maybe they had a bad month, and they call and they're like, yeah, but where's all my new patients? Man, like, that is not what you...
There's a give and a take. Yeah.
It's a lot of money to acquire an implant patient, right? And it's a different style of marketing than just I'm picking up any D0150 or in a family. When I'm targeting points of need versus people moving into the area, that's a different strategy, and that costs something. And even the costs are different, right? Implant related keywords are significantly more expensive. And that feels very impactful to me when that happens, because you said you were good. Maybe even the words, if I just get 20 new patients, I'm happy, because you're fee for service, but I want to chase implants. But I think it gets back to what you were saying. We were either not having a conversation around you're going to give something up to have these, or you took away something you didn't understand out of the conversation. But to let it get to the point of that panic text is a challenging thing, because you just can't switch it on a dime.
Exactly. That's such a great point. And I think here I'll go back to putting some of the responsibility on the marketing agency. Then you need to set expectations. Far too often, if we're now speaking to my marketing peers out there, you try and hide the bad news. You try and cover it. You try and soft sell it. You butter it up a little bit. I've tried that approach. Bites me in the butt. Doesn't work. Don't do that.
Soft selling.
Don't do that.
The CIO at GameStop I worked under, he had a saying that I've carried with me, bad news ages poorly. And it does.
Again, this ties back to communication. All of this does. If the dentist is asking to move things over, you are the expert. You should be able to communicate, hey, if we do this, we are going to need to set expectations on the amount of new patients that then come in, because we're targeting. And then we're not going to be judging only on new patient numbers anymore. We're going to judge on production, because now you're doing higher production cases, which means that you have actually more of your time. So we can't focus, and that's where communicating success and what's going to happen is so important, because it will determine the success of your relationship at the end of the day.
Well, Ian, what do you think the top 2 or 3 things a dentist can do better around communicating with their marketing team are then? Kind of wrap it up for me.
Yes, sir. So the first thing that I would say is having regular meetings, and not meetings to have meetings. We all know in organizations the amount of fluff and waste of time that goes into just having a meeting to have a meeting. I'm talking about 15 minutes at the start of the day. This is where we're at. This is what I want to see today. Eric, remember, we need to at least try and get this many reviews today. We need to do this. We need to do that because it's important to the vision of this practice. Are we all on the same page? Does anybody have any questions? And try and prevent the every morning of everyone just nodding. Spark conversation. Don't just call to
I
a
like
group.
to rotate who leads the huddle. I like
Exactly.
to, yeah.
And assign accountability. Speak to people by name. If I've realized that if I just say, so who's going to help me with this? Everyone looks around. If I go, Eric, will you help me with this? I'm trying to do this, this, and this, and this. You're assigning accountability, and then you actually have your person. So that's the first thing for me. Have effective huddles in the morning. The second one for me is conflict in the office is bound to happen. Don't try and avoid it. Address it and make sure that you're listening before you are talking, to make sure that you, as the commander-in-chief of this business, is aware of what is going on, what is both sides of the story, communicate why it's frustrating you and why it's hurting the business for this to be happening, and unpack things instead of kind of going the high school route of people kind of segmenting in your business, and now you have an inefficient team.
Yeah.
And the last one, I mean, those two for me are probably the most important, Eric. And I think people can solve 90% of their problems in the office and alignment and communication just by starting there. The third one I would probably touch on is invite your team to come and talk to you so that you have an understanding of what's going on in your business. You can't solve a problem as the visionary of this practice if you do not understand the problem to begin with. So invite your peers, whether it's your treatment coordinator at the end of the week or your hygienist. What are some problems that you experienced this week? Like what can we do? How can I better support you? And by communicating about these things, we're kind of uncovering what is needed and then growing the business in a way that's productive in the long term for everybody.
No, very well said, Ian. Very well said. That's instead of using 32, I'm going to use just about 5. That's a great place to wrap it up.
Yes, sir. Thank you so much, Eric. It's great to be here.
That was your Body Dental Marketing for the day.